Do you remember this is median nerve? And here do you see, do you see medial and lateral trunk, which complete into the medial nerve, visit into the axillary cavity, the axillary artery. Axillary artery is continuation of the subclavian artery. This is subclavian artery. Here is brachiocephalic trunk. On right side, it divides into the subclavian and carotid common. My finger, this is clavicle. Below than the clavicle, continuation of the subclavian artery is called axillary artery. Below than the lower margin of the pectoral major muscle, its visit to the arm is called brachial artery. In the cubital fossa, the brachial artery will divide into the radial and ulnar. Axillary artery, it has three topography regions. One will be from clavicle to the upper margin of the pectoral minor muscle. It has triangular shape. It's called clavicular pectoral triangle. Another will be behind triangular shape of the pectoral minor muscle, will be pectoral region. And another will be from lower margin of the pectoral minor to the lower margin of the pectoral major, subpectoral triangle. Clavicular pectoral triangle, subpectoral triangle, and between them is pectoral triangle. Clavicular pectoral, do you see, pectoral and subpectoral triangles. Through these topography regions passes the axillary artery. If you remember last time, I informed you about short branches of the brachial plexus. And for your memory, which is very, very bad, I gave you the information. It's easy to remember three nerves which direct to the back, because they include in their name the word scapula. Suprascapular, dorsal scapular, and subscapular. So the analogous situation here. Axillary artery gives in front of, by first topography triangle, the thoracic superior artery. Thoracic superior artery supplies pectoral major, pectoral minor muscle, and mamma gland. Thoracic superior artery. Another artery, it begins by next triangle, pectoral triangle, and it begins by common beginning. And maybe distance of the common beginning, 2 centimeters, maybe more, maybe lesser, and it subdivides into the two branches. If it has common beginning, it is called thoracoacromial. Thoracic part will go for the helping of the thoracic superior artery, and acromial part will go to the acromioclavicular joint, to the capsule of the shoulder joint. And this artery is called thoracoacromialis. Another artery will join to the lateral side of the thoracic cage, and together with thoracic long nerve will go below. It is called thoracic lateral. Three arteries: thoracic superior, thoracoacromial, and thoracic lateral. They include in their name the word thoracic. Another artery from brachial artery, from brachial artery will go around of the anterior side of the surgical neck to the back. It's called circumflex humeral anterior. Another artery will pass through the quadricular opening together with axillary nerve to the dorsal side of the surgical neck, by which it will travel for the meeting with the circumflex humeral anterior, because it is called circumflex humeral posterior. Another artery, this artery is called subscapular artery. It will begin together with circumflex humeral anterior and posterior by subpectoral triangle. You can see it divides into the thoracodorsal artery, arteria thoracodorsalis, which goes to the dorsal side of the thoracic cage and to the subscapular muscle, do you see, to the teres major, to the latissimus dorsi, and do you see, and another branch is called circumflex scapular artery. Circumflex scapular artery, bring me the skeleton. Circumflex scapular artery by triangular opening. Do you remember? This is triangular opening. Do you see? You can see this is humerus. Do you see? This is teres minor. Do you see with subscapular? This is teres major. And this long head of the triceps. Here will be quadricular open. Here will be triangular open. Did you understand? Circumflex scapular by triangular open will go to the dorsal side of the scapula, to the dorsal side from axillary cavity to the dorsal side of the scapula. By inferior scapular notch will come into the supraspinatus fossa and will anastomosis with arteria suprascapularis. Suprascapular artery is branch of what? What are branches of the subclavian artery? What are branches, recollect me, what are branches of the subclavian artery? Subclavian artery gives vertebral, gives below thoracic internal, and gives cervical trunk. Cervical trunk gives thyroid inferior, cervical ascending, and suprascapular. My dear, I lose my interest for discussion you something. You don't remember something. We did major about head and neck. You don't remember something. How you will study by next your life, I don't know. Suprascapular artery, do you see, comes to the supraspinatus fossa and anastomosis with suprascapular artery, which is branch of the cervical trunk from subclavian system. The brachial artery, do you see, which is continuation of the axillary artery. It by its subdivision, do you see, its branches will supply the whole free upper limb. And if here, for example, by any mechanism, we will cut hand, we will cut the fingers, the doctor must do operation. And for operation, he must decrease the bleeding. How we decrease bleeding? When we studied the abdominal arteries, how we can decrease the bleeding? By what mechanism? By ligation of the artery. What is ligation? This is pressing by threads. After the finishing operation, after correction of the vessels, we will take out the threads and we will produce the normal way of the blood again. We cannot ligate brachial artery if we will have the bleeding below, because in 30 or 40 minutes later, our operation will not be important because we'll start necrosis. And you can see how we will help. We can do ligation of the axillary artery, above than the beginning of the subscapular artery, above. Because the blood, the diameter of the brachial artery is near 1 centimeter. Do you see? And you can see the diameter of the suprascapular, circumflex scapular artery in 4 or 5 times lesser. Because the portion of the blood, which will come by, suprascapular, circumflex scapular into the subscapular, and after that by axillary into the brachial, will be in 4 or 5 times lesser. Did you understand? And we will decrease the bleeding. suprascapular artery, anastomosis with circumflex scapular. Circumflex scapular will bring blood into the subscapular. Subscapular will bring blood, do you see, into the axillary artery below then the ligation. And this blood will go into the brachial artery. Arteria axillaris gave thoracic superior, thoracoacromial thoracic lateral. It gave circumflex humeral anterior, circumflex humeral posterior, and subscapular arteries subscapularis. Listen to me. Upper limb is very important for our life. It is very mobile because the mobility of the upper limb is important for, do you see, our comfort life. And because all those joints which are placed on the upper limb and same on the lower limb, do you see, they have around them the big arterial articulation net, plexus arteriosus. Plexus arteriosus of the shoulder joint. It gets blood from thoracoacromial, from circumflex humeral anterior, from circumflex humeral posterior. If I will press circumflex humeral anterior, from another artery the blood will come. I will, by extension, press circumflex humeral posterior, from another artery into this net will come blood. If I will do SLI, I will press thoracoacromial, from circumflex humeral anterior and posterior the blood will come. Brachial artery. Brachial artery is placed in the bicipital medial groove between biceps and brachial muscle, and by short distance it gives muscular branches to the all muscles which are placed around of it. This is whole anterior group. Coracobrachial, biceps and brachial, they are supplied by muscular branches of the brachial artery which is placed between them. And from brachial artery begins the artery which goes together with radial nerve, which goes into the spiral canal and comes to the back of the arm. It is called deep brachial artery, arteria profunda brachii. Arteria profunda brachii gives muscular branches for the dorsal muscles. What are dorsal muscles? Triceps brachial muscle and ancanelus. And deep brachial artery, arteria profunda brachii, which came to the back, it divides into last branches. One will come to the dorsal lateral or radial side, because this is radius, this is ulnar, do you see, to the dorsal lateral or radial side, and is called collateral radial. Another will come to the dorsal medial side, is called collateral medial. The deep brachial artery, after giving of the muscular branches to the posterior muscles, it subdivides into the collateral radial and collateral medial. If you remember, by beginning studying of the vascular system, I said you 90% of the arteries, they code anatomical order about short distance from their beginning to their object. 90%. Listen to me. Here we have collateral radial, collateral medial. Do you see, is long distance. The word collateral, it informs us. It doesn't go directly by the short distance. It doesn't accord this order. Did you understand? You can see, after giving of the deep brachial artery, which is on the back subdivided into the collateral radial and medial, near the beginning of the deep brachial artery begins artery which goes along of the ulnar side to the back of the medial condyle of the humerus. Do you remember last time we studied here the ulnar nerve? Do you remember? And here came collateral ulnar superior artery. Collateral ulnar superior artery. Again, it doesn't go direct. It goes through the long distance. Do you see? When the brachial artery, do you see, is placed above then the cubital fossa. If you remember, cubital fossa has incorrect rhomboid shape. Near the upper angle of the rhomboid shape, the brachial artery, gives to the anterior side of the medial condyle of the humerus collateral ulnar inferior. Collateral ulnar inferior, collateral ulnar superior to the back of the medial condyle, deep brachial artery, arteria profunda brachii. These are special branches of the arteria brachialis. Did you understand? Arteria brachialis came into the cubital fossa and divides into the radial artery, which do you see by radial groove will come below. Radial groove is placed between brachioradialis and between flexor carpi radialis. And this radial artery goes below. You can see before continuation below of the radial artery, it gives opposite artery, which is called recurrence radial. It will come for the meeting, for the communication with collateral radial. Collateral radial will communicate with recurrence radial. After that, do you see radial artery, after giving recurrence radial, it directed into the radial groove below, by radial groove below. Ulnar artery, which is subdivision of the brachial artery, do you see? It gives branch, which is called recurrence common ulnar. Recurrence common ulnar divides into the recurrence ulnar anterior, which anastomosis with collateral ulnar inferior, and recurrence ulnar posterior, which anastomosis with collateral ulnar superior. Collateral ulnar superior from brachial artery. Anastomosis with recurrence ulnar posterior from recurrence common, which is branch of the ulnar. Collateral ulnar inferior, anastomosis with recurrence ulnar anterior from recurrence common ulnar from ulnar artery. Collateral radial from deep brachial, anastomosis with recurrence radial from radial artery. After giving of the, do you see, recurrence common ulnar, it gives interossal common artery. Interossal common artery. Interossal common artery subdivides into the interossal anterior, which by anterior side of the interossal membrane will go below, and interossal and interossal posterior, which perforates interossal membrane, comes to the dorsal side of the interossal membrane, and by which will direct below. Radial artery, it passes by radial groove, do you see? Interossal anterior, it passes below by anterior side of the interossal membrane. Interossal posterior, it goes by posterior side of the interossal membrane, do you see? And after giving of the interossal common, which divided into the interossal anterior and posterior, ulnar artery came into the ulnar groove and together with ulnar nerve directed below. When this artery, do you see ulnar artery, comes below, in front of the radiocarpal joint, it gives carpal palmar branch. Radial artery, it gives carpal palmar branch. Here in front of the radiocarpal joint, they subdivide into the many branches and they do net. It's called rete carpi palmaris. Ulnar nerve gives the ulnar artery gives to the back of the radiocarpal joint dorsal carpal branch. Radial gives also dorsal carpal branch. They came to the back of the radiocarpal joint and will do net. It's called rete carpi dorsalis. Interossal posterior comes and this is subdivides into the branches which complete into the rete carpi dorsalis. Interossal anterior perforates interossal membrane, comes to the back and also brings blood into the rete carpi dorsalis. Rete carpi dorsalis, this is carpal dorsal net which gets blood by dorsal carpal branch from radial, dorsal carpal branch from ulnar, from interossal posterior, and do you see, by visit in front of by interossal membrane, interossal anterior. From dorsal carpal net will begin 1, 2, 3, 4 metacarpal dorsal arteries. They will come into the interdigital folds, you see, and will subdivide into the digital dorsal, into digital dorsal. The number of the metacarpal dorsal arteries, 4. 1, 2, 3, 4. 4 will come to the tip of the fifth finger by dorsal medial side of the fifth finger without division. The first, second, and third inside in the interdigital fold will subdivide into the digital dorsal. You can see ulnar artery after giving carpal palmar, carpal dorsal branch by itself will come to the palmar side and will lie on the muscles, this on the medial palmar group, and will be covered only by this palmar eponeurosis. This is palmar eponeurosis. Do you see? Here we cut it for showing deep problem, but it is wide. And this ulnar artery lies, do you see, behind of the palmar eponeurosis on the muscles of the medial palmar group. And radial artery is directed, do you see, to the back. And before visit of the radial artery to the back, it gives superficial palmar branch. It communicates with the concrete ulnar artery, and they do superficial palmar arc. From superficial palmar arc begin 1, 2, 3, 4, like on the back, but they are called digital common arteries. 3 from them will come into the interdigital folds by parallel location, then the division of the metacarpal dorsal into the digital dorsal. They will be parallel. Digital common will come parallelly into the interdigital folds and will divide into the digital dorsal, into the digital propria. Here will be digital propria, here will be digital dorsal. Listen to me. Do you see we have interphalangeal joints? Do you see? And here we have digital dorsal, here we have digital, do you see, propria. Here we have digital dorsal, here we have digital propria. Here. On both sides we have communication digital arteries. Here, everywhere. Did you understand? Okay. Radial artery, after giving of the superficial palmar branch, which connects with ulnar artery and does superficial palmar arc. From superficial palmar arc began digital common arteries, 3 from which will divide, and the 4th don't divide, will go about palmar medial side to the fifth finger, to the its tip. After giving of the superficial palmar branch, radial artery comes to the back into the first, do you see, metacarpal space. Before its visit does inside into the first metacarpal space, it gives arteria metacarpia dorsalis prima. It will subdivide, do you see, to this side of the thumb and to the dorsal lateral side of the second finger. 1, 2, 3 branches it gives. It's called arteria metacarpia dorsalis prima, first metacarpal dorsal artery. After giving of this branch, radial artery comes, do you see, through the first metacarpal space to the palmar side. This is superficial palmar arc. It is placed on the muscles. When the radial artery will come back, it will lie behind of these muscles on the bones, metacarpal bones, and will continue from laterally to medially. Like ulnar artery continues from medially to laterally, radial artery will continue from laterally to medially very deeply. Ulnar artery, before production of this superficial palmar arc, gives inside deeply palmar deep artery, arteria palmaris profunda. Arteria palmaris profunda will anastomosis with concrete radial artery, and they will do deep palmar arc. Superficial palmar arc is formed by ulnar artery, superficial palmar branch from radial. Deep palmar arc will be formed by visit,